Welcome to Jose R. Reyes Memorial Medical Center, Neonatal Intensive Care Unit, also known as NICU. NICU. It is located on the second floor of the main building, besides the delivery room. What is Neonatal Intensive Care Unit? A neonatal intensive care unit, also known as intensive care nursery, is a unit specializing in the care of ill or premature newborn infants. Neonatal refers to the first 28 days of life. Healthcare providers assigned in this unit have undergone special training, and this unit also provides the necessary equipment to give its patients the best possible care. Newborns are admitted to the NICU due to the following reasons: prematurity. Babies born early, less than 37 completed weeks, is the most common reason for a NICU admission. Respiratory distress syndrome, sepsis or infection, hypoglycemia, and lastly, perinatal depression. Now, let's talk about the areas inside the NICU. First, step-down area, located at the front of the nurse's station. This area are for those patients that have no contractions except an orogastric tube or OJT, have completed antibiotic treatment, or small for gestational age premature babies still needing further weight gain. Number 2. Neomedical area, patients with complications upon birth needing medical management. Number 3. Neosurgical area, for those neonates that have undergone surgical operation. Number 4. Isolation area, to prevent cross-contamination with other non-infectious cases or those needing reverse isolation. Number 5. Breastfeeding room, a place where the mother can do breastfeeding or kangaroo care for her baby. Hearing screening room, where the hearing test is done. Weighing area, where the baby's weight is monitored. Bathing area. Treatment area, where the medications and intravenous fluids are prepared. Nurse's station. And lastly, the doctor's area. Room temperature of 22 to 26 degrees Celsius is monitored every 8 hours to prevent overheating or hypothermia of the babies. Express breast milk or pasteurized milk are safely kept inside the freezer, maintained at a negative 15 to 25 degrees Celsius, and is also monitored every shift. The NICU is capable of carrying a total of 30 infants. Then, the pandemic happened.
The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020.
COVID-19 can infect anyone, from the elderly to the newborn babies. The whole country have to adjust and comply with the new normal. NICU modified its areas in accordance with the IATF guidelines on social distancing and proper PPE. Furthermore, limiting the total capacity of the unit from 30 to 15 patients. Overall, for the step-down, the breastfeeding room was converted to a COVID-19 isolation room in order to accommodate 2 COVID-19 suspects. The regular isolation room was also converted to a step-down isolation for those babies who are negative for COVID-19. Now, let's talk about services offered inside the NICU. The healthcare team always practice the 5 moments of hand hygiene. Admissions may come from the delivery room by giving birth via normal spontaneous delivery. Admission may come from the main operating room if the baby was delivered via cesarean section. Admissions may also come from the emergency service complex if the baby was delivered within the institution or inside the emergency room. Upon receiving the patient, the nurse will check the patient's name on the chart and counter-check it with the patient's name tag. The nurse will also check if the sex of the baby is accordance with the patient's chart. If the name of the baby and sex have matched, the nurse will now weigh the baby. After weighing, the baby will be placed on the warmer to further regulate its body temperature. The nurse also conducts a complete physical assessment while the baby is in the warmer. If the patient needs further oxygen support, an oxygen is readily available besides the warmer. After the baby got warmed up and stable, the patient can be now placed to a bassinet. An incubator is also available to use and is designed to provide a safe, controlled space for the infant to live while their vital organs develop. These are the indicators to use an incubator: babies born prematurely, breathing issues, effects of gestational diabetes, low birth weight, and recovering from surgery. A mechanical ventilator and a cardiac monitor can also be provided if the patient needs further oxygen support and closely monitored. A transport isolate is like a portable incubator. This is used to transport the infant to a radiology department or heart station to conduct any diagnostic imaging or procedure. The babies are weighed and bathed daily. After bathing, a new bed cover and draw sheet is placed on the infant's bed. Phototherapy is used to treat newborn jaundice by lowering the bilirubin levels in the baby's body through a process called photooxidation. Nurses take the vital signs every hour or every 15 minutes, depends on the severity of the case of the patient. Expressed breast milk or pasteurized milk is given to the newborn babies via cup or tube feeding. Newborn screening is done after 24 hours of life. This is done in order to find babies have certain serious medical conditions. Therefore, treatment can be started immediately. Hearing screening is done in order to detect problems as early as possible because this can affect the infant's speech, language development, social skills, and education in the future. Caring for COVID-19 suspects or confirmed case. The physician or nurse is required to don a full PPE upon entering the COVID isolation room. All care management are still provided and rendered to the patients, such as physical assessment, vital signs, giving of medications, feeding, weighing, and bathing. After the physician or nurse is done with his task, he or she can now exit the isolation room and properly doff his or her PPE. Afterwards, take a shower and change their scrub suit. These are the services rendered inside the NICU. Thank you for watching. And always remember, we give the utmost care for your babies.